Alright, here we have the radius and ulna. Now, the radius is a lateral bone, meaning that it's more toward the outside of your body, and the ulna is a medial bone, meaning it's more toward the middle of your body. Now over here, you can see this flat end of the radius. This flat end is the head of the radius, and because it's closer to the center of your body, this is going to be a proximal head. So this is the proximal head of the radius, and it fits nicely into this notch of the ulna. This is called the radial notch of the ulna. So the head of the radius fits right into the radial notch of the ulna. And similarly, here is the head of the ulna. Because it's farther away, this is the distal head of the ulna, okay? And the distal head of the ulna fits nicely into this notch of the radius. This is the ulnar notch of the radius, okay? So radial notch of the ulna, because the head of the radius fits nicely into there. Ulnar notch of the radius, because the ulna fits nicely into that notch. Alright, now up here, next to the radial notch of the ulna, we have this U-shaped depression. This U-shaped depression is referred to as the trochlear notch, okay? And this process here that sort of extends from the trochlear notch, this is called the coronoid process. And up here we have the olecranon, okay? So olecranon, trochlear notch, coronoid process, radial notch of the ulna, where the head of the radius fits into, ulnar notch of the radius, where the head of the ulna fits into, and down here, you can see that there's a pointy bit of the ulna. This pointy bit is called the styloid process. Now, the radius also has a styloid process. This is the styloid process of the radius. And one more thing that I should mention is that there are two areas here that are called tuberosities. Tuberosities in general are going to be attachment points for muscle. So this would be the radial tuberosity. This would be the ulnar tuberosity. Okay? Now, one tip in terms of being able to orient the radius and ulna is that the ulna, you can tell it's an ulna because of the U-shaped trochlear notch, but you might be asking yourself, okay, which way does it go? Does it go this way? Does it go this way? Which way? Well, the trochlear notch is part of the elbow joint. So when you bend your elbow, the ulna is making this kind of motion. And so when you supinate your arm, meaning palms outward, the trochlear notch has to be facing outward, because that's what allows us to bend our arm that way. Okay? So now we know, okay, the ulna goes this way. Well, what about the radius? How do we know? Okay? Here's a tip. If you look, this is sort of a flat surface of the ulna, right? And on the posterior is also a flat surface. But where those surfaces meet, we sort of have this pointy line. And this pointy line should face toward the radius. Okay? The radius also has a pointy line, and that pointy line should face toward the ulna. So these two pointy lines should face toward each other, and when you orient them so, the head of the radius is going to fit nicely into the radial notch of the ulna, and the head of the ulna is going to fit nicely into the ulnar notch of the radius. And that's pretty much all you need to know about the radius and the ulna.